I'm clicking start now. Everyone, please mute themselves.
Both on the desk.
Yeah, that's what I was just saying.
All right, so let me start by saying good morning to everybody. I hope that folks are able to log in and join us, and I want to thank everyone for joining us today. I wanted to have this town hall with the campus community to talk about a few things, but then also present the platform for us to engage in a conversation and answer questions about the return to campus for Coppin State University. And so I'm glad that everyone could be here. And my hope is that you and your loved ones are well and safe in this extraordinary environment that we find ourselves in. You know, I know that the current environment that we find ourselves in is not easy for any of us to accept. And I want to express my deepest appreciation to everyone for your dedication, your commitment, your hard work, and your patience over the last several months as we've developed our return to campus plan and as we have developed to prepare ourselves for what is next for Coppin. Before I go on in my remarks, I'm going to pause for a minute and ask Angela to introduce our Coppin COVID-19 task force. This group has played such a instrumental role in helping to develop our university plan, as well as think through various scenarios and get us to a strong position of reopening for the fall. So Angela, if you would do that, please.
Good morning, Coppin. So the Coppin State University COVID-19 Task Force members are as follows: Angela Galliano, Chief of Staff and Project Manager; Provost Leonte Lewis; Dr. Michael Freeman, Vice President of Enrollment Management and Student Affairs; Stephen Danick, Vice President of Administration and Finance; Dr. Ahmed Elagun, Chief Information Officer and Vice President of Information Technology and Institutional Advancement; Derek Carter, Director of Athletics; Matthew Frailing, General Counsel and Legislative Affairs Officer; Dr. Tracy Murray, Dean of the College of Health Professions; Dr. Siobhan Darden, Associate Director of the Community Health Center; Dr. Lisa Early, Associate Vice President of Human Resources; Dr. Dion Kirby, Deputy Chief Information Officer; Dr. Erica Covington, Faculty Senate President for the 2020-2021 year; Dr. Charlotte Wood, Faculty Senate President for the 2019-2020 year; SGA President Crystal Chukwu, 2019 to 2020; Essence Bennett, SGA President, 2020 to 2021; Student Monet Myers; Student Alexis Sullivan; Karen Barlin, Registrar; Kevin Pertee, Director of Residence Life; Kendrell Edwards, Director of Housing; Michelle Reynolds, Director of the Center for Counseling and Student Development; Reginald Love, Director of Business Services; Roy Thomas, Director of Facilities; Anthony Littlejohn, Staff Senate President; Sheila Chase, Staff Senate Vice President; Lieutenant Lawrence Ames, Campus Safety; and Aaron Singleton, Director of Communications.
Thank you, Angela. And again, let me thank our team for the outstanding job that they have done and that they are continuing to do for the university. You know, I know many of us are tuned in daily to the latest news regarding the pandemic and its impact on our state and community. The changing environment and its implications have not been lost on me. You know, this fall is quickly approaching, and some students, faculty, and staff have began returning to campus. In fact, some have never left. And I know that many of you have questions about Coppin's decision to operate this fall in a low-density residential and teaching model. In preparation for our return, I have corresponded with several of our university stakeholders, including our Coppin COVID-19 task force, as well as several Baltimore community leaders regarding my position. As president of Coppin, I feel profoundly responsible for the safety and well-being of our campus, those who work and study here, as well as those that call Baltimore home. You know, the path that we are taking during this pandemic is driven by data, science, and both our mission and values, and not by anything more. You know, rather, our choice to operate in this modality for fall is fostered by the understanding that for many of our students, they learn better in a face-to-face setting. And for others, the understanding that Coppin is their home, that Coppin is that family and that support that they need, that we are a place of serenity and security, and a place for a consistent meal. And I am committed to do all I can to make sure that we keep our students safe and healthy and moving towards their educational dreams. You know, our students' pathway to graduation and to upward mobility would not be possible without the strength, guidance, and mentoring of our faculty and staff. Thus, ensuring your safety and your well-being, to me, is equally as important. Hence, this is why over the past few months, we have assessed, planned, and walked through multiple scenarios in preparation for fall. And I want to thank again our incredible Coppin COVID-19 task force for their thoughtfulness, their insight, and their expertise. You know, our plans, although still evolving, have been developed by relying on evidence-based best practices that have been laid out by health professionals at the federal, state, local, and university levels. We have also benefited from the leadership and the resources and the camaraderie of Chancellor Perman, the USM team, the Board of Regents, and our fellow presidents from across the system. And let me be clear, no, our plan is not perfect. And we will never be in a position to forecast every hypothetical scenario. Nevertheless, I feel strongly about what we have developed and what we are continuing to develop for our campus. As you can imagine, none of this is easy. That is why I thank you all for your patience and your questions, your suggestions, your understanding, and your unwavering commitment to Coppin. This fall, it is profoundly important that we work to keep our campus safe. We will continue to use signage and multiple forms of campus-wide communications, videos, and other mechanisms to foster expectations and acceptable behaviors. By returning to campus, we are all agreeing to undergo ongoing testing and to adhere to all state, local, and university mandated guidelines and policies. As this situation evolves, our plans and our efforts will evolve. And despite our best efforts, I understand and I expect that there will be cases that will appear in our campus community. And we will address those situations as well as keep our community apprised of such matters through our weekly communication and how we are addressing those matters. So let me touch on a few more things that I think are very important, and then we will open it up for questions. For months, I am sure that many of you have heard the term quarantine 100+ times. And what does that mean? In the context of your employment at Coppin, a quarantine means that you must be away from the campus and or isolated from the campus community for a designated period of time. And in an effort to comply with the standards of the CDC, that quarantine period for us and that time here at Coppin is 14 days. And yes, if you have tested positive for COVID-19, that 14-day period is mandatory. And so I want to be clear that when we talk about quarantine, that we have a clear definition to operate from of how we're going to enforce that here on our campus. You will also hear, and you've heard much and will continue to hear much about testing. Testing will play a significant role in our ability to maintain a safe and healthy campus environment. After multiple conversations, I have concluded that we will test our campus community once a month for the remainder of the semester. In addition to our testing, we will also use our daily symptom monitoring to assist with our surveillance testing efforts. With regards to testing, let me be clear on this. All right. So if you have had a test that predates July 22nd, you need to be retested. And starting this Friday on August 14th, we are having testing right here on campus. And we have several days where we will be testing our campus community free of charge right here on campus. If you've had a test that is on or after July 22nd, you do not need another test. You simply need to make sure that you submit your results to HR. And those results need to be submitted to HR by no later than August 28th. By chance, if you have taken a test and you are waiting on results, you are fine. All right. We want those results, and it's important for you to get those results to HR. Your results can be submitted to HR through a couple of ways. Now, it can be sent via email, because HR is also working to make sure that we can enhance whatever contactless approach we have to submitting documentation to the university. So those documents can be faxed, and we will make sure that that number is shared with the campus community, or they could be sent via email, and we'll also make sure that the email is sent and shared with our campus community. Let me talk about one or two more other pieces that I believe are very important, and that is if you find yourself impacted by the COVID-19 virus. We know that it impacts people differently and in different ways. And if you are in a situation where a family member, unfortunately, has contracted COVID-19, and you are required to help address their needs, under the CARES Act, you will be provided 80 hours of emergency paid sick leave. Now, that is at 2/3 of your pay. And therefore, because of that act, that 2/3 will cover 2/3 of your salary for those 80 days. The additional 1/3 of your time will need to be covered by your personal accrued annual leave. And so I want to make that clear on how we will be addressing that under the CARES Act, so that we are clear as an institution. Now, here's another piece that I think is very important, and I want to make clear. If a coworker contracts COVID and you or your office is required under the direction of the university to go into quarantine, you will be placed on administrative leave and are not required to use your own accrued vacation. Let me say that again so I can be very clear. If someone in your office contracts COVID-19, and out of an abundance of safety, we send that entire office home while we do cleaning, and we are contact tracing, and we are requiring additional testing, that office or individuals of that office will be placed on administrative leave. That action and directive under the university will not require you to use your personal accrued annual leave. And several days ago, I sent out a message outlining some travel guidelines for the university. And I want to be clear on making sure we understand what those guidelines are. If you travel more than 75 miles beyond the state or into one of the designated states that have been classified as a hotspot, you are to quarantine for 14 days. Now, I understand that there are hotspots throughout Maryland, and that's why the actual emphasis is placed on 75 miles beyond the state, or if you enter into one of the states that has been designated as a hotspot. So I wanted to make sure that we understood what that travel message was and to be clear about that. Now, there'll also be some questions, I'm sure, about university travel for the upcoming year. University travel will be heavily scrutinized. That decision will be left to the vice presidents and their respective areas, but we will be looking at university travel more stringently than we have had to do in the last several years. And so I just wanted to put those things out and set the tone and the table for us to have a good discussion here today. And let me be clear, Coppin. As I said earlier, none of this is easy. This situation and our environment is changing around us daily. And therefore, our policies and our processes and our actions will change daily. The only way that Coppin is going to get through this situation is by coming together, by acting as a community where we are responsible for ourselves and accountable for our actions. And I'm challenging all of us to do our part to make sure that we take care of ourselves, that we look after ourselves, but that we also hold one another accountable. And making sure that people wear their mask, that they adhere to the guidelines of the university, that they are in tune with the signage that we have around campus, which is outlining distance, social engagement, and so forth. If we do those things, and with the plan that we have in place, I feel confident that we will have a successful fall semester. But again, I cannot do it without you. This is a team effort. This is about Team Coppin, and I need everyone to play their role. So with that, I thank you very much. Let's kick our semester off strong and make sure that we are doing all of the right things. So with that, I will open up our town hall for questions, and I look forward to the conversations. All right, Angela.
Thanks, Dr. Jenkins. The first question we have is, Morgan, Johns Hopkins, and other campuses have changed course of action and have gone 100% virtual for the fall. Might Coppin decide to do that and switch to 100% virtual in the fall?
You know, thank you for that question. That's an excellent question. And typically when you see schools around you start to shift their, modality of operation, obviously that generates questions for us and other institutions. As a USM system school, we have made a collective decision to start our semester off in the format that we are using here at Coppin. Johns Hopkins and Morgan, as independent institutions, they have made a decision that they believe is best for them. I do not believe that if we started our semester off any differently, that we would be in a much better or stronger situation. I think that you will also see some other institutions who are starting the first 2 to 3 weeks online, and then they are going to transition to a face-to-face model. I believe that is more complex. I believe that it creates more inconsistency for students and for faculty and staff. So while I can appreciate what Johns Hopkins and Morgan and some others are doing, again, I am very confident in the plans that we have put in place, with the efforts that we are going to take throughout the remainder of our semester, that we are in a good position to start and finish in the mode of operation that we have talked about. Now, let me be clear. If there comes a point that the data drives that our campus is not as safe as I believe it should be, we will look at curtailing our semester. We will look at simply doing exactly what we did in the spring term, and that is flipping our campus 100% virtual. If the numbers and the data dictate that, we will do that. We will not stay the course if science and data and my conversations with our community experts and our university experts, if all those conversations and data indicate we need to do something differently, we will change course. Okay, so let me be clear about that. Next question.
Please elaborate on the ongoing testing. While you have stated that the campus will be tested every month, who will manage this process?
So we have a team of individuals being led by Dr. Tracy Murray and our health providers who have carved out a solid plan on how we are going to be testing our campus starting this weekend and moving throughout the fall semester. So we have a plan in place. We have partnered with some external health experts who will help us collect samples, ship those samples off, and then get the results back to the institution. So that will be our process for the monthly testing that we will conduct here on campus. And if I didn't fully get to the crux of your question, please feel free to submit another question and drill down just a little more. But that is the overall process that we're going to use. Everything that we're looking at for our campus, we are involved in that. So it is not simply some external entity dictating to the university what we should be doing. We have experts here on our campus who are involved in the conversations. They are helping to drive those narratives and put in place the right procedures that we need to have to make sure our campus is as safe as it could possibly be. Any additional question?
Is COVID-19 testing required for the entire Coppin community, even if they are working remotely?
Great question. So no, the actual testing is for those individuals who will be working on campus and living on campus. Now, if you are a student and you are not living on campus, but you will be coming for face-to-face classes, yes, you will need to be tested. If you are having any interface with the campus during the fall semester, you will need to be tested. But the actual testing is not mandatory for 100% of the Coppin community. It is for those individuals who are living on campus, will be working on campus, or need to interface with the campus for any given reason. Okay?
Is all of this written somewhere so we can review it?
Yes, it is. It is in our COVID-19 return to campus plan, which is on the university's website. And as we've been saying multiple times over the summer, driving individuals to the website to look at our plan and understanding that our plan is evolving as the situation evolves. As the environment changes, our plan will change. But you can go to the university's website and we can make sure that we send out that web link again, that folks can go to our COVID-19 webpage, look at our plan, the actual communications that have been coming out from the president's office over the last several weeks, as well as the information we're talking about today. We will make sure is on that page and updated. We work to make sure that page is updated several times per day with the most relevant and accurate information.
I've heard of a case in public safety. As of today, the campus has not been alerted concerning this situation. Is the campus being secured since public safety is on quarantine?
So let me talk a little bit about how we're going to notify our campus of any COVID-19 cases that may come up. Once we are informed or we learn about a case on our campus, we will be conducting, starting, I think, if it didn't happen this week, it'll start next week, a weekly notification that goes out to the campus community that talks about the number of cases that we have on our campus. It is important, and I want everyone to understand, we are going to be fully transparent with this situation throughout the fall semester. Now, we will not name names of individuals, and we will not dissect that information based on student, faculty, or staff. We will simply give numbers and help folks understand where our campus is and where we are trending with regard to cases. So that is how we are going to communicate with the institution when we have COVID-19 cases that appear on our campus. Okay. Then let me say this, because I want to be clear about this. We will be very clear and specific on how we are addressing that matter and making sure that the individuals who could have potentially been impacted are communicated with and receive the support they need, as well as testing to make sure they have not been impacted by anyone on campus or who may be passing through campus. So those are the steps that we're going to take to alert and keep our campus apprised of any cases that we have here at the university.
I'm concerned that my COVID test results go to HR. It's part of my health record. Shouldn't it go to the health center?
No, we have experts in HR who are qualified to handle medical information, and therefore, as a faculty or staff member, we believe in looking at the information and the multiple conversations that we've had. We believe that is the best place for it to go. Students' information will go to the health center. And so just because it is a health record, please don't misinterpret that it should be connected with the health center. Our human resources area is qualified and equipped to handle this information in a confidential and secure way.
For clarification, if placed on administrative leave, we will still be paid. Is that only for the person that has COVID-19 positivity or for the entire office or coworkers who are sent home?
That'll be for everyone. Okay, so let me be clear about that. And again, if the university makes the decision to put an entire office on administrative leave, that is a responsibility and directive of the university. And therefore, yes, you will be paid. You will not have to use any of your accrued annual vacation time. Okay, you will be fully covered for that 14-day period. Now, I do expect you to continue to work remotely from home if you can do that. All right. It will not be a 14 days where you get to go and not have any obligations or responsibilities to the university. You will still be required to work remotely if your job permits you to do so.
Does the CARES Act leave allocation also apply to contractual or contingent workers? Meaning, will they, if they need to care for a family member, will they also receive the up to 80 hours of paid leave at 1/3 of their pay?
That's an excellent question. And let me bring in our HR expert, Dr. Early, to help address that question. I want to make sure the actual CARES Act, it talks about workers, it talks about dependents, it talks about several elements, and I want to make sure we get this accurate. So, Dr. Early, could you chime in with that question if you heard it, please?
Sure. The emergency paid sick leave for the employee who may be ill or out due to COVID is for 80 hours of paid leave. If it is a family member that the employee is caring for, that's when the 2/3 pay kick in, and that's the 2/3 of administrative leave, and the employee can use their own accrued leave to supplement the 2/3, meaning we would use 1/3 of the balance from your accrued leave to ensure that the employee has a full 80 hours of wages.
What about for contractual employees?
It is applicable for all employees,
Correct.
contractual included.
Okay. Thank you, Dr. Early.
The plan on the website doesn't have all of these details. Will the plan be updated with the most recent information?
Yes, it will. As noted earlier, as these plans evolve, we will continue to work diligently to make sure our plan is updated. Again, every time there is some new or different piece of information or data that comes out from the CDC, or from our state, that creates a ripple effect that requires us to go back and look at our plan and to see how we can address whatever that situation may be in the event that it impacts our campus. So yes, we'll go back and we'll make sure, as I said earlier, working to update this daily, multiple times, so that you can have access to the most accurate information that we have at this point. Okay.
How are adjunct professors to handle leave if they contract the COVID-19 virus?
We would operate in the same fashion. Let me again bring in Dr. Early to make sure that that is the interpretation of the act and the policies that we have put forth. Dr. Early?
The CARES Act does allow us to provide the same leave benefits for our adjunct faculty.
Thank you.
I am concerned about cleaning between the use of classrooms. Who will do this?
Excellent question. As obviously, the cornerstone of the COVID-19 discussion has been about cleaning, sanitation, all of these things. And so we have a very robust schedule that will allow us to clean classes in between use. What you will notice is when one class is finished, there will be a team that comes in and clean your or that particular class. That door will be closed and there will be a seal placed on that door that indicates that room has been cleaned. If you approach any door or room and that seal is broken, that room has not been cleaned. Okay, that is the indicator that the room has been cleaned. It will be our university cleaning team so we can move more fluidly and make sure that it is done correctly. And so that's how we are going to be cleaning rooms. Every room will be cleaned in between classes. You will also notice and see that we are doubling down on cleaning of common spaces and other heavily traveled spaces throughout campus. So you will see our cleaning teams about. We are making sure that we are cleaning bathrooms at a higher rate than we have previously. You will see more hand sanitizer throughout campus. These are just some of the steps that we're taking to make sure that the actual cleanliness of our campus remains above reproach.
Please clarify exactly how the campus mask mandate will be managed, including handling of violations.
Sure. So first and foremost, as I said earlier, we need to make sure that we are responsible and holding other people accountable. It will be mandatory that masks will be worn on campus. And again, throughout the signage and other important information that you see around campus, it will outline social distancing and all of those very important steps. Individuals who, for any other reason outside of, let me say this. If you have a medical reason that prevents you from wearing a mask, that is a conversation that we will have and take into consideration. All right. Clearly, we are not going to require someone to do something that would jeopardize their health. And there are some very limited cases like that. Everyone else will be required to wear a mask on campus. It is mandatory. Individuals who do not comply with that mandate are subject to sanctions. Students will be held accountable through our student conduct process, and faculty and staff will be held accountable through our university HR policy guidelines. This is serious, and there's no room for anything other than full commitment to wearing masks. It is a requirement in the state of Maryland. It will be a requirement on campus. So folks should be used to, by now, wearing masks and socializing with mask on and doing so in a safe way. And so our campus is going to be no different. All right. So it will be handled for faculty and staff through HR, and for our students, we will use our student conduct process.
Have all of the buildings, classrooms, tables, desks, and chairs been sanitized? Contract workers have been on campus since March.
Yeah, we continue to be in a constant rotation of cleaning campus. And so our team is continuing to do that. We've had students move in to our residential halls. We have and will continuously clean those. We will continuously clean classrooms, common shared spaces, and so forth. So yes, we have a plan in place that enhances the number of times we are cleaning all of these spaces throughout campus. Even when we have visitors, be it contractors or whoever, we are going back and we are making sure that we are keeping campus as clean as humanly possible. Now, that requires all of us to do our part, okay? And so we clearly cannot just leave it to our cleaning team. We need folks to make sure that they're cleaning up after themselves, that they take advantage of the wipes that we have around, the actual hand gel and sanitizer and so forth. But the buildings, our floors, our tables and so forth, all those elements are a part of our cleaning routine for our entire campus community.
Will security be placed at the entrances of the buildings to assure that everyone who enters the building is wearing a mask and has a valid CSU ID?
So another excellent question. We are balancing the use of our University Police Department and technology. Every student, staff, and faculty member will only have access to buildings using their university ID. You cannot get into the buildings without the use of your university ID. And yes, we will have public safety throughout our campus facilities, making sure that folks adhere to the mask policy and so forth. Now, are we going to have a police officer or a campus security officer patrolling every hall and knocking on doors and so forth? And I know that's not what you are asking, but no, we are not. To me, it is very important that we don't turn our university into a police state, right? And I'm challenging all of us to make sure that through the sense and value of community, that we are responsible for ourselves and holding each other accountable, okay? So that's where we are going to have to challenge each other. When you see someone who's not wearing their mask, please challenge them to go put it on. If they are defiant in doing so, then we need to know that. And then, as I said earlier, the actual appropriate actions will be taken to make sure that this does not become something that is acceptable throughout campus.
Are students returning? I read that a lot of campuses are seeing students go to community colleges because it's cheaper. How is our enrollment? So
let me answer the first part of that question. Yes, our students are returning. We reduced our housing model. We went to a low density model for housing. We went to about a 50% model, which means that we have about 300 plus students who will be staying with us in our residence halls. And I think at last count, we are full, I believe, but I'm going to have Dr. Freeman chime in on that. But our students have wanted to get back to us. We have had an actual waiting list for housing. And yet we are balancing that with making sure we do not interject more students than needed into our campus community with the understanding that we're trying to keep things balanced. We have not heard, I have not heard personally, and I'll let Dr. Freeman talk on this as well. I have not heard of any of our students going to two-year institutions for the upcoming fall. Our enrollment, as like most institutions, if not all institutions across the state and nation, we need to continue to work on getting our students returned back to us. Our enrollment is down compared to the same time last year, but we have seen some pretty good traction. We still have several dozens students. I want to say at least 100 plus students that we need to get registered, and that we are working with those students. We have several few more 100 students who are going through our SAP appeal, which is Satisfactory Academic Progress, which is linked to their financial aid. And so we have pockets of students who are trying to move back to us, and we are doing everything we can to help them do that as quickly as possible. There are some things that are beyond our control. They need some external documentation from the federal government and otherwise. But we are committed to making sure that we help all of our students get back to us who have a desire to do so. But I have not heard of any students who have opted to not return to Coppin and go to a community college in the face of COVID-19. Let me bring in Dr. Freeman for a moment and have him touch on anything that I did not speak on, or add some further information to what I said. You're on mute, Doc. There you go.
Dr. Jenkins, I think you hit everything right on cue. Currently, we have 302 students for possible 320 spaces in the residence halls. We're maintaining a waiting list of about 45 students. And so we have sent information to those students to determine their interest in getting an assignment on campus. That should be happening in the next week or so. On the end of enrollment, we have not had a lot of students contacting us about withdrawing and going to community colleges. Currently, we have 2,018 students who've registered for the fall semester, which is about 100 less than last year this same time. And as you indicated, we do expect, like most universities, to have some downturn in enrollment given the pandemic that we're in. But for right now, we're tracking pretty well on target. Thank you.
Thank you. And to that question, I'll just add this. We are still working with a number of our graduate students. That is the group who has not returned back to the university at a rate that I would like to see. And so we need to continue to build inroads in getting our graduate students back and keeping them on track. And so all of those pieces add up to what our enrollment will look like for the fall semester. Okay.
What type of leave should be used if someone travels and has to quarantine for 14 days? The travel is personal.
Okay, so let me answer this question, and then I'll ask Dr. Early to also chime in. If you are taking personal leave, personal vacation, and you travel beyond the state or to one of the hotspot states, when you return, yes, we're asking you to quarantine. All right, that quarantine will be your personal leave time. That is a personal decision that you made. It was not travel, university related, or mandated. Okay, so if it's personal leave, non-university affiliated that you are taking when you return, yes, that will be your personal leave that you will use over the 14-day quarantine. Let me bring in Dr. Early to have her add any additional information to that question or to my response.
I will just add that that those rules are imposed because, as Dr. Jenkins reiterated, it is personal travel. It's a personal choice that you made. We manage within the confines of Coppin's as a business, and as a business, we have established a rule that we discourage travel outside of the 75 miles. So if you make the personal choice to make personal travel, then from the employer perspective, you made that decision, therefore you should use your own personal leave for the quarantine period.
Thank you.
How should faculty deal with class absences in the virtual setting? How do we determine the legitimacy of COVID-related absences or the usual absence regarding students?
That's an excellent question. And so right out of the gate, I'm going to punt this to the provost, and I'm going to have her respond to this, and I'll follow up. All right, Dr. Lewis.
I'm here. Thank you so much, Dr. Jenkins, and thank you for that question. One of the things we have to consider is the fact that students in their situation, they too are going through a lot during the pandemic. And so we have to be quite lenient in our approach to addressing students' need. We also have to remember that as faculty members, all our courses and aligned documents are in Blackboard. And so a student may not be in class because of COVID or because of caring for others or because they just are absent, but let us keep them on track through Blackboard. Let us continue to communicate with them. And at the offset of your meeting with your students, whether it's virtual or face-to-face, let's remind them to communicate with you so that you can help to keep them on track. And so we should not be just counting every absence because at any minute something can occur, but let us be real considerate and lenient with students and look more at their addressing the content, the course outcome, the learning outcomes, the required assignments that should be posted in Blackboard. And when they do that, then that's where we need to be looking at as a measure of meeting that course requirement. So we are being quite lenient to make sure that we accommodate and we show the human side of who we are and what we do as we put students first and consider their health and the fact that they too are caring for many family members, and so need for us to be as considerate as we can be.
Thank you, Provost. Just let me also add on that if, as a faculty member, obviously your role with the retention and the development of our students is the cornerstone of what we do here at Coppin. If you have a student and that student has fallen off the radar, please, we need to know about that. And what I simply mean is if that student either stops participating virtually or what have you, we need to have a system in place, and provosts and others will be talking about what we have in place that the faculty member can say or reach out to someone to say, hey, I had this student in my class. They've not been engaged for the last several days, or they are not responding. It could be a technology issue. It could be a health issue. But then we need to do our part to make sure that we can follow up with that student outside of just the actual day-to-day faculty interaction, because there are other implications, right? If the student just stopped participating, there could be financial aid implications. There could be health implications that has actually prompted that. So again, we want to make sure that we have a mechanism in place to capture those data so that we can have the right wraparound and support services for students who are in that particular situation. Okay.
I tried to schedule an appointment for testing on campus, but the dates offered seem to be filled or not available. Will there be additional dates added for students and faculty to be tested on campus?
Yeah, great, excellent question. And look, Coppin, I thank you all for responding to the actual testing option that we are providing here on campus. I understand that the appointments went very quickly, which is great. And we do have multiple days, and I believe it's, I'm going to turn to Dr. Murray here to confirm, but I know that the 14th is a date. Is it the 15th, 17th?
The 21st.
21st.
And the 22nd.
Okay, so 14th, 15th, 21st, and 22nd. And yes, we will set up more dates if we need to make that happen, okay? Again, we want to make sure everybody has the opportunity to be tested. And so if all those dates for those particular days are all full, then we will definitely provide an additional date. And I know Dr. Murray had outlined a couple of additional dates, but we wanted to hold off to see how the actual participation was going to go, understanding that now that many people have responded positively to that, we will look at adding those additional dates and getting that information out to the campus community. Okay, Dr. Murray, anything you want to add to that with regards to the testing?
We did add additional times. We're added to the weeks for next week for the Friday and Saturday.
Okay,
So we'll go back and look and see if those filled to capacity yet and adjust accordingly.
thank you. Okay, and we'll get that information out to the campus community based on what Dr. Murray finds out. Thank you.
How can you determine if students commuting to campus have been tested?
Again, very, very good question. As I said earlier, anyone who is going to interface with campus, if students are coming to a face-to-face class, if students are coming to have a discussion with their advisor face-to-face, if students are coming to take care of any business on campus, they will have to be tested and submit their results to the health center. That is the requirement for anyone who's going to interface with students. Now, the other piece that we have been looking at is that if a student has not been tested and they come to campus, that student will not have access to university buildings. So whether we look at a deactivation of their ID card or some other measures, those are some of the steps we are still looking at and working through. But that's an excellent question. And our goal is to make sure that we communicate to students and help them understand that it is mandated, and that once we receive the actual documentation of results, those students will then be looked at, and in the system, they will be either coded as complying or coded as not complying. If we look at all the students who are going to be taking face-to-face classes, and we compare that list to the students who have been tested, we can identify those individuals who have not. We can continue to reach out to them and mandate that they get testing and submit the right information. If they fail to do that, we can limit their access to campus.
How many people among faculty, staff, and students do we expect to be on campus on a regular basis this fall?
You know, that's a good question, and one that we don't have a concrete answer to. We can tell you, we can simply go by the number of students we are going to have living in our residence halls, the number of faculty and staff who are going to be working on campus on a daily basis. We can give an actual number from that perspective. I will tell you that still 90% of our teaching modality will occur online for the upcoming fall. The percentage of faculty and staff who will be working on campus this fall, I believe, is somewhere between 25 and 35%. And I'm going to have Angela chime in on that to give some more concrete information. But for those individuals who are moving through and about campus, it will be a challenge for us to get a consistent count on a day-to-day basis. All right, Angela, you want to add something to that? I saw you indicating.
Yes, so we will have approximately 37.8% of the staff working on campus while everyone else will be working remotely. That could change based on the needs for the semester. So it could go up or down, but right now we're about 37.8%. On the student side, there will be up to 320 students in the residence halls. And the courses, and I'll let the provost correct me if I'm off on the numbers, but I believe out of 812 sections, 66 of them are being offered on campus. So 66 of 812 course sections being offered on campus.
So again, we are trying to use a de-densified model as much as possible. That gives you some sense, hopefully, of the numbers and the percentages of what we're going to be doing for the fall and how we are going to look.
External testing sites have a shortage of tests and will not test for a return to work if we have no symptoms. What do we do?
Again, that's why we are setting up the opportunity for you to be tested here on campus. That's an excellent question. To your question, we also have students who are in places where some areas and states won't test you if you do not have symptoms. And so that's why we wanted to provide the opportunity. If I was going to require the actual mandate for everyone who's going to interface with campus to be tested, then obviously we had to provide a platform for you to do that. So if you have visited some locality or doctor's office and they will not test you because you are not showing symptoms, then the campus testing is an option. Angela, I saw that you wanted to add a little more to that response.
There is a link that we included in the President's weekly newsletter communication that was released on Monday, and also last week as well, for external testing locations that will test you in the Baltimore area, even though you're not exhibiting symptoms. So if you just follow that link, you can find a location that would be convenient for you.
Thank you. All right. So hopefully between those locations and what we're doing here on campus, that will provide options for those individuals to be tested. Okay. Thank you, Angela, and thank you for the question.
Do we have to be tested if we are coming to campus maybe once or twice to pick up equipment or documents during the fall semester?
Yes. Short and simple. Yes. As I said, anyone who is going to have any interface with campus for the fall, you need to have been tested, and your results need to be in to HR if you are a faculty or staff. Yes. Great questions. All right. What else, Angela? What else do you have?
If a faculty member who is teaching a face-to-face class is experiencing symptoms of COVID-19, what is the faculty member expected to do? Cancel the class or run the class as planned?
You are to cancel the class, notify your chair or dean, if not both, so that we understand, first and foremost, so that we understand what's going on with you, because we want to make sure that you have the right support mechanisms you need. Okay. All right. And yes, I do not expect, and you are not required to go into a classroom where you are feeling ill or you believe that you have symptoms of COVID-19. And the provost is jumping to get in. I'm gonna get you in, provost. I'm gonna get you in. But I want to be clear about this. All right. None of us are supermen or Wonder Women, okay? And I don't want people to act that way. If you are not feeling well, if you answer yes to any of the daily questions on our symptom monitoring document, then follow the instructions on that document, okay? If you get here and when you left home, you were feeling fine, and you get here and you start to feel ill, then I want you to immediately alert someone and then go home. All right. And we will take care of the class. All right. And if they don't have anyone else to teach it, I'll go in and teach it. All right. So that's what we're going to do. But I do not want anyone putting themselves in harm's way or trying to push through not feeling well. All right. It is important that if you have any symptoms, that you take care of yourself first. You heard me say self-responsibility and accountability. You take care of yourself first so that you then can help us take care of each other. All right. All right, Provost, what do you want to say?
I wanted to clarify, but you got it. But I wanted to say that not to cancel the class for the remainder of the semester, but not to work that day. Let the chair and the dean know so we can cover the class. And you have the volunteer. Dr. Jenkins will cover. We'll find someone to cover, but absolutely take care of yourself first, because we want you to be here in the long run. So that's the minute point I wanted to make, not to cancel the class in totality, just that that day and let us know so we can make sure we have coverage while you heal and come back as strong as you were before. Thank you.
Thank you, Provo. All right, what other questions?
If staff in my department have come in contact with a department that has been quarantined, why has my department not been contacted and or quarantined as well?
Okay, so because I'm not sure, obviously there's some question there that's not a full question, and I'm not sure of the particulars. Okay, so let me do this. Let me bring in Dr. Early, because I hear a case scenario in there, but because if I don't have the particulars, I'm not sure. Let me take a stab at it and say this. Okay, if there is a office that we believe a individual has tested positive for COVID-19, okay, we're going to do our assessment and contact tracing, okay? And if there's been overlap between your office and that office, then yes, we want to make sure we do our due diligence and look at who that individual may have come in contact with, okay? And then take the appropriate actions on the part of the university which puts you in the best position possible, okay? Now, if someone on campus, and I understand this was not a part of your question, but I just want to make this clear. If there's someone on campus in a department and they have no interface with your area, right, clearly, then your area wouldn't be put on any administrative leave and so on and so forth. I just want to make that clear that we have to, through our contact tracing, be able to see there was an overlap or that person interjected themselves into your space that would cause concerns. All right. Let me bring in Dr. Early to try and clean that up a little more. But again, because of the question, I understand what you're trying to get at, and I just want to make sure we can answer it as accurately as we can without any important details being shared. Dr. Early, can you hear me?
Yes. Upon receipt of notice of someone that has tested positive for COVID, we do conduct the assessment and really ask questions to determine who that individual may have come directly in contact with, meaning being directly in the presence of that person for a sustained period of time. Those individuals are provided notice to quarantine. And for the individuals who are quarantined, we determine if they start showing symptoms within 3 to 7 days, they're tested anyway. That's part of the plan. And they show symptoms and they test positive, then we notify secondary individuals who may have come in contact with them. So we start immediately with those who are in direct contact with the individual who tests positive. And then the secondary layer we deal with as far as assigning quarantine if the direct contacted people are test positive for COVID. So that there are layers, but we do take it serious, and we are asking those questions to make sure, and we crisscross dates and times of when individuals may have come in contact with each other and the length of time they may have been around each other. But we are taking it seriously, and we are asking those questions so that we can have a good list of knowing who to contact and notify if there's been a possible exposure.
Thank you, Doctor. And listen, let me just on the tail end of that question, team, listen, I don't want anybody to think that we are not going to be transparent through this entire process. Now, we have to make sure that we are protecting individuals' medical rights under HIPAA and so forth. But we are going to make sure that we notify our campus. And as Dr. Early said, if we believe through our contact tracing that there was direct interaction with someone for a period of time and the person could have been exposed, there will be more intimate conversations, right? But we are not going to leave individuals and offices unattended when we have been notified as the university that there's a case and there's some cross-pollination that could have taken place, okay? I want to be clear about that. I want everyone to feel comfortable with that. Transparency is going to be key. I do not want nor need any conspiracy theories, no paranoia, none of those things. All right? How we make this thing work is by coming together as a community and being candid and being authentic, transparent, and honest with one another. Okay? So I'm asking all of us to commit ourselves to that. And if you believe that a situation occurred and it was not handled correctly, I want to hear about it. Okay? Let me be clear. I want you to contact me. I want to hear about it because this is a serious situation and we're going to take it seriously. And I believe that we've done that up to this point. And so I just want to make sure and be clear that you hear it from me that those are the expectations that I have for our leadership team and for us as a campus. All right. All right. Any other, I know there's some more good questions.
Should we still telework regardless of our status if we can?
Yes. So if you are quarantined, all right, I still expect you to telework. Okay. Now, that's if your job permits. If you have a job where you cannot continue your job because your job requires you to physically be here on campus, then obviously that is something different. But if you have been able to telework thus far and you are quarantined, yes, I expect you to continue teleworking, right? Because we need what you're doing to add to the overall movement and progress of Coppin. So I don't need anybody to stop. So if you stop, that means our progress slows down.
Is proof of testing required in order to pick up parking permits?
No, no, because you can pick up your parking permit at this point. When have parking permits gone out? What's the date that they've started going out?
They're scheduling appointments for people to stop by and pick up their parking permit, and everyone should have received the email. I believe 2 of them went out earlier this week.
Okay. All right. So please feel comfortable picking up your parking permit and so forth. Okay. Again, your testing results have to be into HR by August 28th. Okay. Once we hit that August 28th deadline, team, that's when everything is in full effect. All right. Everybody who has any interface with campus and so forth has to have a test on file or their access to campus will be limited. Okay. What other questions?
What type of mask is required?
You know, that's an excellent question. And we've heard conversations about different types of masks over the last several days, weeks, and months. I'm going to bring in Dr. Murray on this. I would tell you that we are providing masks for everyone on campus. I know that some folks will need a more specific type of mask. There are variations of masks. And so let me bring in Dr. Murray to help chime in on this conversation. Most importantly is that I want you to have a face covering. Okay, let's just start there and let's know that piece is non-negotiable. All right, whether you are wearing the actual branded face covering that we are providing with our beautiful Coppin State logo on there, or you have your own, or you want to come in with a high-end N95 mask, that is completely upon you. All right. I want you to do what you feel is most important that reassures your safety while here on campus. But Dr. Murray, let me have you chime in for me.
Well, thank you so much. And you pretty much covered most of what I was going to say. so I don't have to add much. But most importantly, if anybody has any kind of health issues, then clearly a surgical mask or the N95 you mentioned, but that would be provided by your healthcare provider. They would tell you that. Beyond that, the face covering that you've talked about, Dr. Jenkins, is quite fine. But most importantly, also make sure they'll stay 6 feet apart from each other and use other precautions. That's going to be so critical.
Thank you, Dr. Murray. I see Provost, you wanted to chime in on something.
I just want to also add to that for those faculty members who have graciously agreed to deliver face-to-face instruction, we have purchased face shields for them to wear in addition to their face mask. And so that is on the advice of Dr. Murray and the health team. So we have that additional resource ready and available for the faculty who have agreed and are willing to be on campus.
Thank you, Dr. Lewis, for that.
Thank you both. All right. And
Will-
as the provost, I'm sorry, Angela, as the provost said, listen, I know some additional folks wanted to teach face-to-face. I know everyone is not comfortable teaching face-to-face, and that is fine. I greatly appreciate, as I said earlier, all that you're doing to help keep our students moving forward and moving towards their educational dreams. For those individuals who are going to be teaching our face-to-face classes, thank you very much. And yes, we will continue to make sure we do everything we can to put the right support mechanisms around you so that you continue to feel as safe as possible while teaching this fall face-to-face. Okay? What else do you have for Angela?
Will there be temperature check-in stations for symptom assessments?
Yeah, that's a great question. We talked about that. Let me bring back in Dr. Murray. We talked about that because we also know that there are going to be times where there are some folks who need to interface with the institution and maybe waiting on testing results. And so how we set up an opportunity for them to be temperature checked and so forth is something that has been a part of our conversation as of late. Dr. Murray, you want to add anything to that?
So we want everybody to continue to do their daily screenings. And in that daily screenings, it says if you have a fever, to please to stay home and to contact your healthcare provider. We've identified some high-risk areas that includes the health center and also the athletic area, where those individuals, by the nature of their work, do close contact with our students or other individuals. We'll be doing temperature scanning before people enter those particular areas and do pre-screening questionnaires before they go into those particular areas. Outside of that, everybody's still encouraged to do their daily screening on a regular basis.
Thank you. And listen, let me say this, right? I know having a town hall is challenging in this type of environment, right? Because typically when you ask a question and then I respond and, the president doesn't respond fully the way, to every aspect of your question, you get to ask additional questions and so on and so forth. And in this environment, that's just a little more challenging. But if your question was not fully answered rather, then we'll create an opportunity for you to email your questions to us or any additional questions, and then we can share those in a frequently asked question section on our COVID-19 website page, okay? So I don't want anybody to think that that their question wasn't fully vetted or answered, and we want to get all the answers that we possibly can and make sure that we're accurate on all of our information. And so if you have additional questions or follow-up points, and if we don't get to it here today, please make sure that you email that to me, okay? All right, what else do we have, Angela?
And just as a reminder, we'll also be providing a return to campus overview on Monday, August 17th during University Day. So you can also ask any follow-up questions then as well.
Sounds great.
The next question. When students go home after Thanksgiving break, they will be online for the rest of the semester. What is the plan for faculty and staff after the holidays?
So if I'm understanding that question correctly, let me take a stab at this. Our face-to-face classes obviously would flip. So the faculty members who were teaching those face-to-face classes, you would then be teaching from home or some remote location that best suits you, but you would not be on campus teaching for the remainder of the semester. For the other 90% of the classes that were already online, that modality will continue. The students in the residence halls will return to the residence halls, and then they'll finish out the academic semester that way. So they will be engaging in their classes in the residence halls, but not in the face-to-face model that we're starting our campus off with. Okay. You want to add anything to that, Provost, or are you good with? Okay.
I'm good. I'm good. That is correct. I'm good.
Okay.
I'm working in my office alone. Can I take off my mask during that time?
Yes. All right. Listen. At the end of the day, team, we are trying to balance health and safety with comfort and reasonability. Okay. If you're in your office and you are by yourself, feel free, please, to take off your mask and so forth. It would be the equivalent of you driving in your car by yourself. My hope is that you're not driving around Baltimore with a mask on in your car. But feel free, take it off, those things when you're in your own private spaces. Okay.
What do we do if it's
I'm sorry. So to that same question, I do not expect people to walk past someone's door if they're in their office and say, "Oh, you don't have on your mask. I'm going to go tell." No. All right. That is not the type of environment that I am looking for. All right. But if you are in your office, please feel free to take off your mask. That is completely acceptable. All right. All right. Go ahead, Angela.
What do you do if a student refuses to wear a mask? I'm sure we can ask them to leave, but do we involve campus security?
So excellent question, and this question has come up. No, we're not going to involve campus security. We are going to involve our student affairs experts, and we have some individuals. Back to the question earlier, we will have some safety officers and some hired additional support who will be manning many of our stations in our buildings. And we will be working with them, and they will be trained and well-versed on how to remove a student from that setting so that they are not disrupting the academic setting or the business of the university. When we interject university police, it now can potentially move from an educational moment to really an actual criminal, well, not criminal, that's not the right word, an actual legal matter, okay? Because once a police officer, a sworn officer, gives you a directive, you're obligated to follow that directive. If the student doesn't do that, it's now no longer a university matter. It's a matter between that student and that police officer. And we want to, first and foremost, use educational opportunities. But if a student is defiant, if she or he refuses to wear their mask, yes, we have individuals, and we are finishing developing that process that I've asked Dr. Freeman and Steve over our university police department and some others to come together and work out how that process is going to work for us. But I do not expect and do not want faculty or other students getting into any unfortunate conversations or engagements with students who refuse to wear a mask. Simply, you will have the opportunity to identify who to contact. They will intervene, and that student will be removed from the environment. Okay? What else, Angela?
If we use personal leave for quarantine, does that mean we are not required to do university work at all over the 14 days?
That's an excellent question. It's a tough question. I want you all working all the time, right? So even when you're on vacation, Right? I want you thinking about Coppin and doing work for Coppin. So, that's my position. But in reality, no. If you are on vacation, that's your personal vacation, and you are not required or expected to do any telework from home when you're using your personal vacation. Now, I know Dr. Early may say, no, Dr. Jenkins, I didn't want you to say that, but that's my position on that. And again, those are your personal hours and times that you've earned. So I do not expect you to be teleworking. Okay? Are we okay with that, Dr. Early?
That's fine.
Okay. Thank you, Doc. All right. What else, Angela? Do we have any other questions?
Have there been changes to the academic calendar given the implications of COVID-19? For example, are any dates or deadlines extended, like applying for fall or registering for classes? It was announced that the on-campus semester ends at Thanksgiving. Will classes still be conducted through the traditional exam schedule ending in mid-December?
Okay, so I'm gonna let the provost chime in on this. She almost jumped through the screen when she heard that question. So calm down, provost. So there's been no changes to the academic calendar. Now understand, when we come back from Thanksgiving, we will be completely online as we were in the spring, and we will finish out our semester accordingly, just like we did for spring 20. With regards to deadlines and other things, clearly those are more specific questions that I do not have the answer to. So Provost, let me have you chime in. You could probably get at where some of this question was going. I just can't answer some of the specifics about dates.
Thank you, Dr. Jenkins. The semester dates remain the same. The only change, of course, is, as was shared earlier, that we will be pivoting to a complete virtual platform after Thanksgiving. But the deadlines for exams and all the other deadlines are still in place. None of that will be changed. And so we want you to continue to manage your semester, manage instructions after Thanksgiving in the normal fashion, using the normal deadlines, just through a virtual platform.
All right. So, and I suspect, Provost, that you're going to have some additional questions about that. Please, again, if her response or if the question generated another question in someone's mind and we don't get to it, please submit those questions, or like we said earlier, we'll have the opportunity to revisit some of these new questions that we didn't get to during University Day. Okay? Angela, what other good questions do we have?
Some employees reported back to work prior to the testing mandate. Are those people now required to submit a negative COVID test to return, or will they continue to do the online assessment until they submit results to HR by the August 28th deadline?
All right, so let me see if I understand this. So there are some team members that we have that are already on campus. All right, so let me go back to what I said earlier. If you've taken a test that predates July 22nd, I need you to be retested. If your test is on or after July 22nd, you are fine, okay? I hope that kind of clears it up a little bit. So again, before July 22nd, I need you to be retested. After July 22nd, you are fine, okay? Dr. Early, is that consistent with my position on that and what we've been saying?
Yes, it is.
Okay. All right. So thank you. Again, excellent question. Want to make sure, obviously, this is a great opportunity for us to, clear up some of the water cooler conversations that have been going on across campus and be more consistent with how we're going to function for the remainder of the semester. But again, prior to July 22nd, get tested. On or after July 22nd, you're fine, okay?
Several residential students are traveling from hotspots. How will this be addressed?
Excellent question. So when our students come in, and again, This is why we also set up the actual testing opportunities. As we said earlier, some states, even those hotspot states, are not testing you if you are not showing symptoms. So we have set up our actual testing to help dig into some of that and build inroads there. We are also making sure that when students get here, they have access to being tested, and then what we're doing in our residence halls. Let me bring in Dr. Freeman to also touch on that, to give you a full comprehensive view of how we're addressing our students who are coming from those hotspots. You're on mute, Doc.
Off. Okay, there you go.
All right.
So for our students in the residence halls, we've been in touch with them all summer. And as you know, they are dealing with COVID where they are, and we're asking them to understand that we're opening the residence halls in the safest possible fashion. So when students come to campus, or before they come to campus, we're asking them to quarantine 14 days. They need to take their test and bring their results, or upload their results to the health center. Once they arrive on campus, we're asking students to sequester themselves. Students that are from hotspot areas, we're asking them to quarantine for 14 days on arrival. And we'll identify those students, and we have those dates for when they are moving into the halls. The rest of the students we're asking to sequester to the campus, which would include their residence hall space, dining halls, and then if they happen to have an in-person class. So basically, we're talking about them confining themselves to the campus space. Testing will go on, as already been indicated, on the 14th and 15th, the 21st and 22nd. And students who have not had an opportunity to test will be able to sign up for a reserved space at that time. And so students are also signing, upon moving into the residence hall, an affirmation statement. The affirmation statement suggests that they will comply with all of the mandates from the CDC, the wearing of masks, the 6-foot separation, the washing of hands on a regular basis. And they're also being given a document that indicates what happens if they are not, if they're not compliant, and those codes within the student conduct that that line up with complying with the request of university officials and not disrupting educational activities. So we've covered the waterfront. RAs are on campus now, and they're being trained to respond to all of those issues and to monitor the regular cleaning that we have set up. So we're in good shape at this point.
Thank you, Dr. Freeman. Again, if the question was not fully answered to what someone was expecting, I'm encouraging us to send in additional questions as well. Okay. All right, Angela, any more questions?
I believe we have time for one or two more questions.
Okay. All right.
So the next question is, the COVID-19 virus has a 14-day incubation period with no symptoms until the 14th day. Would daily testing be better?
You know, that's an excellent question. And I will tell you that even our outstanding health experts are all over the map on this. There have been studies, and there are continuing to be conversations about whether daily testing, testing every 2 days, testing weekly, bi-weekly, monthly is the best option, and so forth. I will tell you, I do not have the best answer or response. I do not know. I'm simply listening to our experts and taking their guidance on what is the best option for us at Coppin. Put aside the actual financial obligations of an actual day-to-day test, and put aside understanding how that could be taxing on the campus community, right? I just don't know if you get more significant results from a day-to-day test as opposed to a weekly, bi-weekly, or monthly test. Now, I tee that up simply to bring in Dr. Murray and to have her chime in on what she's heard, what the conversation is in the medical field as of now. But I will tell you that based on my decision to test us monthly, that was built upon the medical experts' recommendations that Dr. Murray and I talked about, and that some of the folks that she's talked to also. So not sure which one is better. Obviously, one would believe if you test more frequently, you get better results and so forth. I don't know if that's the case with this COVID-19. But Dr. Murray, what would you say about that piece?
I would say, Dr. Jenkins, you're correct. Daily testing would never be recommended, but the daily self-assessment is what is recommended. And it will end up having the same yield potentially as if we tested individuals.
So Doc froze for a quick second. She'll get back to us. But to your question again, what the health experts are saying, and I know there's been studies from Yale and from Harvard and so forth that contradicts what the CDC is saying, and the CDC contradicts what they are saying. And so, team, that really crystallizes why I'm going to bring you back in, Dr. Murray. That really crystallizes why all of this is so challenging and why it's so important for us to do everything we can to take care of ourselves and one another, right? So, Dr. Murray, let me bring you back in. We got just to where you were saying that the day-to-day testing was not proven, and then you froze.
It's not proven to be very accurate. Actually, the tests that we have right now, we know we have false positive and false negatives, and it's best on people who have symptoms. So we're doing a baseline at Coppin State University, and most of the universities are throughout the nation. We'll be really answering the question, what does Coppin look compared to Baltimore City residents? That's our best hypothesis, what we're trying to answer, and just having a baseline to make sure it's staying lower than what is in the state of Maryland's rates. That's what we're really answering. But we don't really want to be just testing people, doing invasive nasal procedures for people who don't have symptoms.
Excellent. Thank you, Dr. Murray. Okay. All right, Angela, do we have time for one more question?
Only if you'd like.
All right, bring it on.
Okay, so last question is there an institutional policy available for CSU students and faculty who are engaged in internships and community service in the COVID-19 environment?
See, I knew I should have stopped. All right, so no, again, that's a part of where we are continuing to expand our conversation and our plans, our policies and procedures. Now, that's going to require us to also have conversations with our internship partners and so forth. Now, the provost had to step off, but clearly we have teachers and we have nurses, and they do, residencies and internships with schools. Well, if schools are not open, clearly we can work around that. Dr. Murray can talk a little bit about what the actual nursing piece looks like, but we want to make sure that our procedures are developed well enough and succinctly that our students are clear on what we can do from the university standpoint, what the national or statewide accreditation associations are asking us to do, and so forth. So the short answer is no, we don't. Are we going to build it? Yes, we are. But Dr. Murray, anything you want to say about nursing and how we're looking to address that moving through this environment?
I'm going to say for the whole College of Health Professions, and I know this applies for the other areas where we do internships as well, is that there already have been a review of some of those processes with those particular agencies, and any of the agreements that need to be updated have been worked on to be updated, and any of the requirements that they've asked us to do, like education for COVID and other components, are going to be in compliance to make sure we have a full fall semester.
Okay, excellent. Thank you, Doc. Okay. All right, listen, looks like we have to wrap it up. Again, I thank everyone for participating. I thank you for your wonderful questions, your insight. I welcome your feedback. And Coppin, listen, we will get through this. All right. I want all of us to remain Coppin strong, mask on, and let's charge ahead. Okay. Thank you. Enjoy the rest of your day and have a great weekend.